Um, Hello, thank you for joining us. My name is Valerie Wise. I am the Air Service and Marketing Manager for the Wichita Airport Authority. And joining me today is Jay Brainerd, the Federal Security Director with the Transportation Security Administration. And we're talking about spring break and the upcoming summer travel season. And we know people are itching to travel again. As vaccinations are being administered and the travel restrictions lifted, travel demand is increasing. Airfares have been lowered and the airlines have eliminated change and cancellation fees, which also encourage travel. Passengers in the US during the first 7 days of March were at 50% of last year's travelers. For comparison, January US volume was at 38% of 2020, so we are seeing an increase. In Wichita, the airlines are reporting good loads for spring break. This week, passenger volume is averaging 60% of March 2019 and 116% of March of last year. And of course, last March is when the pandemic hit. Friday, we're expecting 2,083 passengers, the highest volume we've had since March of 2019. The airlines are increasing capacity in our market to adjust for expected demand. Allegiant began nonstop service to Destin on March 4th and has extended the season from last year. It will operate until September 6th. So far, that's shown to be a very popular destination. Allegiant will also resume service to Orlando Sanford on May 26th, will operate through August 14th. They will begin Los Angeles service on June 3rd, and that will operate through August 15th. Frontier Airlines added a second weekly flight to Denver, operating on Fridays and Mondays, and began service to Las Vegas just this week, and it also operates Fridays and Mondays. Delta Airlines added a third flight to Atlanta, and American Airlines added 2 daily flights to Dallas-Fort Worth, making 6 daily flights. Flights are being booked on very short notice, as little as 21 days out. This makes it very difficult for airlines to publish schedules 6 months out as they used to. Airlines are now publishing schedules on a very short-term basis to allow them to adapt to demand. So if you are looking to travel 3 to 6 months out, you can go ahead and book, but there could be changes to your schedule. If you have not traveled in a long time, it will look a little bit different than you're used to. We have provided some tips to help you prepare for your trip. As we've always stated in the past, passengers are urged to arrive at least 90 minutes before your departure. We have had passengers that come to the airport 10 minutes before their flight and they miss their flight. You need to allow time to park if you're parking and to get through security screening before the airlines close the door. The park and ride lot is still closed. We just don't have enough passenger traffic at this time to support the shuttle service, but all other lots and the garage are open. If you are arriving or if you are picking up an arriving guest, please use the cell phone lot. You're not allowed to park and wait in front of the terminal. Federal law requires wearing a mask at all times in and on the airport. Failure to comply may result in removal and denial of re-entry and could result in penalties under federal law. You may also risk being on the airline's do not fly list until the pandemic ends if you do not wear your mask on board the aircraft. Boarding procedures have changed. The airlines begin boarding from the rear to the front of the aircraft. The airlines have either suspended their food and beverage service or it's limited depending on the length of your flight. We suggest you bring a snack and a beverage with you on your flight. Beverages will need to be purchased after screening, or bring an empty bottle and fill it from our bottle filling station located between gates 3 and 4. A second bottle filling station is to be installed between gates 5 and 6. We hope to have that functional by May 1st. Our drinking fountains are currently closed off. If you travel to a foreign country, you are required to get a viral test within the 3 days before your flight returns to the US and provide written documentation of your laboratory test, paper or electronic copy, to the airline to provide documentation of having recovered from COVID-19. Airlines must confirm the negative test result for all passengers or documentation of recovery before they board. If a passenger does not provide documentation of a negative test or recovery, chooses not to take the test, the airline must deny boarding of the passenger. This law became effective January 26. Since then, many resorts and hotels are now offering on-site COVID testing, as well as no cost or discounted quarantine programs. If you are traveling to Hawaii, there is a 10-day quarantine restriction for all inbound visitors to the Hawaiian Islands. However, there is a pre-travel testing option that will allow travelers an alternative, allowing them to bypass Hawaii's quarantine restrictions, as long as they bring along proof of a negative COVID-19 test from a state-approved trusted testing partner. A COVID-19 testing office has recently opened on the mezzanine level of our terminal. The test is administered by Prestige Medical Care of Wichita. They use the nasal swab test. The cost is $300 and results are available within 45 minutes. Ensuring the health and safety of the traveling public and the airport workers is always our top priority. Our amazing custodial crew continues their enhanced cleaning processes, electrostatic spraying, and use of cutting-edge disinfection products on high-touch areas. Social distancing and health messaging have been placed on all terminal advertising monitor screens, along with periodic PA messages. Hand sanitizers are placed throughout the terminal. The Harvard T.H. Chan School of Public Health published a study on February 11th that examined the mitigation strategies implemented by airports. And the study finds that the multi-layered approach to health and safety significantly contributes to risk reduction of COVID-19 in airport settings. Several studies have examined the robust multi-layered strategies on aircraft to reduce the risk of exposure to COVID-19 during air travel. The research substantiates that the layered approach instituted on commercial aircraft results in a very low risk of COVID transmission. The study says that being on an airplane is as safe, if not safer, than grocery shopping or going to a restaurant. This information, plus links to find out more travel requirements and tips, can be found on our website, and that is flywichita.com. And now I'll hand it over to Jay.
Well, thank you, Ms. Valerie. Again, my name is Jay Brainerd, B-R-A-I-N-A-R-D. I'm a Federal Security Director for the TSA for the state of Kansas. And Valerie has pretty much covered every high point. The only thing that I would emphasize, I'd emphasize actually a couple of things. The first one is making sure that people wear their personal protective equipment when they're flying. That is, that they show up to the airport wearing a mask. If somebody shows up to the airport, they're not wearing a mask, if we're in a position to offer one, we certainly will. But in order to get through security checkpoint and get on a commercial air carrier in the United States, you have to be wearing a mask. I will tell you that since they've implemented this mandate, the administration has, we've really not had any issues at all. People have shown up to the airport, they've been prepared, they've been ready to travel. So we have not had any issues with passengers coming to the airport that aren't prepared. And there is a general sense of optimism. Obviously the infection rate in the country has gone down significantly because people are taking responsibility, because people are using personal protective equipment, and there's now a vaccine out that people are getting. So very much looking up for the aviation industry. The Wichita Airport has been taking this seriously since this came out. We were meeting as early as February a year ago, not only with stakeholders in the airport, but with also county health. So the Wichita Airport has been one of those airports that's been on the front end of this since it began. All Kansas airports have been on the front end of this since it began. Our workforce comes in every day to work. They screen the traveling public to make sure not only that we have good security, but that we have good safety. And we'll have full contingent of staff here ready to screen our passengers, and looking forward to a very successful spring break, given what happened last year to the aviation system. And Valerie, I'll turn it back over to you or to the folks if they have any questions.
Yes, I'll open it up for your questions.
Do we just talk or
Yeah.
do we raise our hands? How do you want to run this?
Just go ahead.
Okay. I guess my main question as we look at this is you've got this new testing site on the mezzanine. Have you had a lot of people using it yet? How popular has it been?
Well, it just
How long has it been open?
Monday. Yeah, it opened Monday. Don't know how popular it's been yet, so I can't answer that.
Okay.
But you know, it's very helpful if you're traveling internationally or to Hawaii.
Yeah. So it's not required if you're traveling within the country.
No, domestic travel does not require that.
Okay. Do you know how many people have used it? Just like raw numbers?
I don't have that yet.
Okay.
It's brand new. Sorry, I don't have that. Anybody else have a question?
This is Tom Shine from KMEW. Can you hear me?
Yes.
We can, Tom.
Okay. I'm still new with the equipment. Sorry, Pilar.
No problem.
Any indication yet from any of the airlines at some point they may make vaccine a requirement for air travel? I've read that someplace. I just don't know if you've heard anything as that as a possibility down the road.
You know, there have been discussions about what will be required after COVID-19 and what we've learned from this. Just as after 9/11, there were changes in security. I think that the International Air Transport Association is trying to come up with some standard protocol that all airports and airlines can follow so that we're all on the same page. There haven't been any decisions made yet on what the next travel phase is going to look like. Jay, are you aware of anything?
No, ma'am, that's a very good question. I've seen a speculation in the news about it. I've not heard anything from the aviation industry on it. I know that it's a very discussed topic. Interestingly enough, before we started, I was talking with Valerie, and I heard that there are potentially cruise lines and some vacation destinations that are giving away great packages for people as long as they show proof of vaccination, which is separate from the aviation industry. So people are trying to generate. Interestingly enough, you know, the airlines, if you take a look at the media, are really offering competitive fares. And as the vaccine starts making its way out to the general public, I think you're going to see a pretty hard rebound of the aviation system. So there are a lot of people that have expressed interest in getting the vaccine. I will tell you, with our workforce, we're getting our people that we're just in the final lap of getting them vaccinated, thanks to the governor's office for including airline supply line transportation workers in the vaccination, and also Dillon's grocery stores here within Wichita. And we're just finishing up. And once we get done next week, possibly in the next 10 days, we will have vaccinated all of our airport workers that wanted the vaccine. So, you know, there's a lot of excitement about the vaccine coming out. However, when it comes to aviation, I've not heard that there's going to be a contingent that you can fly based on whether or not you've been vaccinated. I do know that the personal protective equipment, wearing of the mask and things like that, are going to be around for a while. We don't necessarily have an end date. I think the initial thought on this was it was going to go to May and they were going to reassess this. But, you know, you take a look at the downward trend of the infection rate that we have as a country. It's at an all-time low. It's just unprecedented. And I'm just glad that people are listening to science, are taking personal responsibility. They're showing up. I think that we're heading in a very good direction. Long answer to a short question, but I wanted to give you some other thoughts as well.
Valerie, your numbers for travelers continue to go up a little bit, getting more better. Do you think by the end of this year, I know it's hard to make predictions, especially with COVID, but by the end of 2021, do you think Wichita Airport will be back to 2019 numbers?
Probably not. The experts, the analysts, the airlines are thinking that this is going to be a transition year. We may see some growth, but 2019 was a record year, not just for Wichita, but for most airports around the country. So I doubt that we'll be at those levels. I think the analysts are saying it could take, and it's really anybody's guess, 2022 will be a much better year. It could take up to 2025 before business travel resumes. Right now, the leisure traveler is rebounding, but not the business traveler. I think part of that has to do with company policies, liabilities in case someone gets COVID when they're traveling on business. And then increased use of Zoom meetings. And I don't know about you, but I think everybody else is sick and tired of Zoom meetings. So yeah, I think it's going to be a while before we get back to 2019 levels. But again, it's anybody's guess. The airlines have suffered a lot this past year. They've taken on billions of dollars of debt. They're going to be very careful and slow to add a lot of capacity until they're sure that this travel is going to be rebounding. And you know, the business and the international traveler is where their high revenue passenger is, and they aren't flying. So the airlines are having to keep their fares at leisure fare levels or lower fares. So their revenue is not where it should be either. So that's another thing that we have to keep in mind. They're trying to crawl out of being billions of dollars in debt. So it can take a while.
Talking about return to capacity, I know that 6 months ago, the number of flights that were going out of Wichita was down, not just the number of people flying, but just the number of planes leaving. Are those starting to pick up as more people are being interested now? Because I know some folks have told me they've tried to go, but couldn't get a seat.
Yeah, and I think that's what we're seeing over spring break, because spring break loads today and tomorrow are pretty full. And I think what we're seeing is capacity in April is going to be up about 22% from last April, which is, you know, when airlines were cutting, but we're still down from 2019 levels. I think airlines, as I mentioned, are going to be very careful in adding seats to a market as they watch bookings increase. Passengers are just waiting to the last minute to book flights now. 21 days, most of the flights are within 60 days. And that makes it difficult for an airline to add capacity, which is why then we have a shortage of supply when all of a sudden we have a passenger that can't get on a plane. So once those bookings starts to go beyond 60 days and the airlines are able to add more seats later, then we'll be in better shape. But like I said, this is a transition year, and the airlines are doing this on a very short notice, very short-term basis. So yeah, that's what's happening. I think the summer, though, they're going to have additional capacity because people want to travel. They are anxious to travel, and they will put more capacity during the summer. As far as fall, you know, who knows? I don't know what it's going to look like. So I hope you guys travel a lot and soon.
I'm already looking at my vacation plans.
Yeah, good to hear that. This is recorded, so if anybody wants a recording, please let me know. And the news article will be posted about 2 o'clock. So if you want to link to it, that'll be there for you. And I really appreciate you joining us today. Do you have any more questions?
I'm good. Thank you for your time.
Yeah, thank you.
Thank you. Take care.